Hey everybody, Dr. Beth Zogg with Zogg Family Chiropractic, and today's topic is Medicare and chiropractic. So a lot of you may have questions like, why doesn't Medicare cover my chiropractic visits every time, or why doesn't it pay for x-rays or exams and this kind of thing? So I just wanted to kind of go through the information directly from the government websites and explain to you how chiropractic kind of got into this mess that we're in. So essentially, when chiropractic first was awarded participation in Medicare, we as a profession were willing to kind of just settle for whatever we could get. And that at that point in time, it was just that Medicare would cover only the adjustment of the subluxation. So chiropractors, this is over 50 years ago, said, okay, we don't care if we get our exams paid for. We don't care if we get our x-rays paid for. We just want to get our foot in the door and have some kind of, benefit to our patients in the Medicare system. So chiropractic in Medicare is not the same as other healthcare providers. We are limited only to this one thing, which is the adjustment of the subluxation. So we've established that Medicare will only pay for the adjustment, but there's more. Medicare will only cover a subluxation that is, acute, that has some kind of a cause, some kind of mechanism of injury, and a condition where the chiropractor can show that there's going to be some expected improvement in a certain number of visits. So let's say that you are, go into your laundry room and you pick up a big heavy basket of laundry, and while you're carrying it, you trip and fall. Okay, so then let's say you have back pain, low back pain after that. That would be a Medicare, for sure, a Medicare covered service, because you actually had a cause of the problem and you're having these symptoms, you're having pain, maybe, you've got some muscle spasm, maybe you've got like a little bit of a posture deformity and so forth. But let's say you are just really a health conscious person and you want to go and get your spine checked by your chiropractor once a month. Medicare will not cover that. So that is just considered prevention or maintenance. Or let's say you've never been to the chiropractor before and you've got some arthritis and some, degeneration in your spine where you probably will always have some discomfort, in your back that is never going to completely go away, and you just want to get adjusted, to kind of just like help with that, but you're not expecting that you're going to have a spine like you're 20 years old again. So Medicare would not cover that either. So there's a difference between an acute problem, like a problem that just happened, that you'd be able to verify with a physical examination, verify on x-rays, and that the chiropractor would expect to see improvement or progress in that condition. And then a condition where it's chronic, maybe something you've had for 20, 40 years, and we might expect some improvement, but basically you're not going to have a complete resolution of that issue because whatever reason, you've had it going on for 20 to 40 years and you've got some like structural changes in your spine that are irreversible. So just keep in mind when you go to the chiropractor, if you have not had an acute injury or something happened recently within the last few months, then Medicare may not cover that exam. It depends. The chiropractor is going to do their exam and ask you questions and make the determination, but you cannot expect that every time you go to the chiropractor that it's going to be covered by your Medicare. Now, here's the kicker. People will say, okay, well, I understand that Medicare won't pay for maintenance, but I have a supplemental insurance and that should pay for maintenance. No, it doesn't work like that. So your supplement, let's say Medicare is your primary insurance, your supplement only covers Medicare covered services, which means they're only going to cover those acute issues. So your supplemental insurance will not cover anything that your regular primary Medicare doesn't cover. Now, there are a lot of Medicare replacement plans out there, and those are kind of a whole different issue, because sometimes they're not really as good as primary Medicare for chiropractic coverage. They might have a higher deductible or higher copay. It just depends. So we're not talking about anything that's a Medicare replacement plan today. We're only talking about if Medicare is your primary insurance. Now, when you go to the chiropractor with, this acute problem, this brand new problem that you had, maybe you tripped, maybe you picked up something heavy, your grandchild ran and jumped on you and now your neck hurts, let's say. Then the chiropractor is going to, take your history. They're going to have you, tell them what happened. They're going to get your entire medical history so they understand, what kind of traumas have you had in the past, what kind of medications are you taking and so forth. And then they're going to get your family history, of course, just like any healthcare provider would. And they're going to want to ask you about the quality and character of your symptoms or your problem. Like, how intense is it? Can you describe how it feels? Does it come and go? Is it constant? Does it radiate? What kind of activities of daily living are you not able to do because of this injury? And then, of course, they'll ask you, if you have any secondary complaints. So maybe you had, your grandchild jumped in your arms, now your neck hurts, and then now you've also got a headache with it. Or maybe you've got pain down your arm or something like that. Then once the chiropractor has, sent you for your x-rays, done their examination, then they will determine a treatment plan for you. And this is kind of based on a level of care. So if you just had a very minor, injury, a little minor strain, then you're not going to need to come as often or as long. But if you have some major problem, maybe you actually fell down the steps or something like this, then you're going to be eligible for a higher level of care, so Medicare will pay for more visits. So it's going to be, designed to fit your exact circumstance with the goals in mind that you and your chiropractor talk about. So maybe your goal is, you want to be able to go golfing with your best friends on your ladies league or whatever it might be. So you'll set these goals with your chiropractor, and then that's what you will work toward, and you'll show progress getting back to those regular activities of daily living. And then the chiropractor will use some objective measures to see how effective that the adjustments are. So they'll possibly take post x-rays, they'll do follow-up examinations, maybe they'll do some heat reading scans. I mean, there's a lot of different tools that chiropractors use. So your treatment plan would be then based off of that date of injury and your first visit, and then going out from there, the chiropractor will have to show Medicare that you are actually improving. So if you go to the chiropractor, you've had some kind of incident, and the chiropractor says, okay, here's your care plan. You're going to need to come X number of visits within X number of weeks, and you don't come in when you're supposed to, then Medicare is possibly not going to continue to pay for that care because you're not compliant with the care plan, and your chiropractor, if you're not coming according to the recommendations, they may not be able to help you as quickly as they normally would because you're not getting adjusted. So make sure that whoever your chiropractor is, whatever plan they give you, that you stick to it, and then that way the chiropractor can show that this care is actually helping you improve. So don't try to, take advantage of like a system where like you say you have an injury and then you only go in once a month for actually just maintenance care. Medicare is going to catch on to that, and they're not going to cover those services. So, as we said, maintenance care is not covered by Medicare. We hope that you will come in at least once a month. Probably most of you would want to get your spine checked at least twice a month. And when you come in for that maintenance care, your chiropractor will ask you to sign an ABN. So this ABN form basically is saying to the chiropractor that you understand that this visit is not covered by Medicare, but you want to receive it anyway. And so this is a form you'll have to it's a requirement. You'll have to fill this form out. And that way then the chiropractor can still take care of you with you understanding you're going to have to pay out of pocket for that visit. Now, there's also something I forgot to mention earlier with Medicare. Chiropractors can be participating or non-participating. So if a chiropractor is participating with Medicare, that means that every time you come in for an acute problem, then they will file Medicare on your behalf, and then you'll pay your copay, whatever that amount is. If the chiropractor is not participating, then you will pay the chiropractor up front, and then Medicare will reimburse you directly. So just so you understand the difference between that. So if you have any questions at all about any of these topics, you can look up on your own the Medicare websites and kind of read for yourself in a little more detail than this video on what chiropractic covers and what it doesn't cover. Basically, just to recap, Medicare only covers the adjustment. It does not cover any exams or any x-rays or any therapies or anything like that. If you live in the Coralville, Iowa area, I would love to be your chiropractor. Our office address is listed on this slide as well as our email. Our phone number is 563-299-4334. My grandpa, who is also a chiropractor, said that the subluxation is the greatest enemy of mankind. So let's get you in and get your spine checked so we can correct those subluxations. Have a great day.